a low-cost, intrinsically safe mechanism for physical distancing between clinicians and patients. Aside from the direct and obvious challenges posed by the novel coronavirus pandemic, there are serious and growing secondary consequences caused by focusing almost all available healthcare capacity on fighting the pandemic. This work is an example of where the medical, engineering, and science communities come together to aid the healthcare system, healthcare workers, and society during the current COVID-19 crisis. This work particularly focuses on using collaborative robots in diagnostics and finds an effective and simple way for keeping healthcare staff safe during this severe time. Medical workers, due to their frequent and close contact with COVID-19 patients, bear a higher risk of contracting the disease. One solution is using personal protective equipment, or in short PPE. However, a strict PPE level reduces medical workers' comfort, efficiency, and accuracy. Another solution is maintaining physical distancing in the clinic that protects healthcare staff from COVID-19 and other contagious diseases and decreases the required PPE level and PPE consumption. Teleoperating clinical tasks from a safe distance seems to be a reasonable and promising solution. Robotic mechanisms as active platforms can help healthcare staff during the COVID-19 pandemic to fulfill a wide variety of tasks from a safe distance. However, these platforms are complex, expensive, and have a long approval process. On the other hand, it is possible to design passive, human-powered, intrinsically safe mechanical solutions for healthcare service delivery from a safe distance. This paper's objective is to perform the design, construction, and assessment of a novel passive health service delivery device that protects clinical staff and reduces human-to-human contact by providing manual teleoperation of fine positioning and delicate manipulation tasks. As shown in this figure, we decoupled the tool's Cartesian motion into horizontal and vertical movements. The horizontal motion can easily be achieved by a 2DOF linear motion stage. To achieve position control in the vertical direction, the end effector should follow a straight vertical line and be remotely controlled with a similar vertical motion at the user handle. We used the grasshopper approximate straight line mechanism to generate the vertical motion. This back-derivable mechanism enjoys an approximately perfect vertical motion with the input and output displacement in the same direction. The proposed mechanism has the potential to be further optimized to enhance its user interaction quality in terms of precise positioning and lower cognitive load on the user while performing the task. The first objective in the kinematics optimization is pure vertical motion. This objective enhances the accuracy in executing clinical tasks. We simply need to minimize horizontal displacements by minimizing the standard deviation of the end effector's motion in the horizontal direction when the user moves the handle to adjust the vertical position. As shown in the figure, the mechanism, after optimization, has better vertical motion. The second objective is the linear mapping between the handle velocity and the vertical velocity of the end effector. That results in a better manipulation and lower cognitive load on the user. There should be a linear relationship between the vertical velocity of the handle and vertical velocity of the end effector P. As shown in the figure, the linearity between P dot of Z and P dot of H increased after optimization. Objectives for the dynamics optimization are truthful force transmission to the user, minimum required effort from the user, and low apparent inertia. The journey of dynamics optimization based on the described objectives starts with the concept of energy conservation. Energy conservation is about maximizing the efficiency of energy flow in mechanical systems. This not only reduces the user's energy consumption and as a result decreases the user's effort, but also results in enhancement of system functionalities such as reduction in the overall weight or improving the quality of force transmission through the system from the end effector to the user's hand. In the paper, we prove that weight compensation provides an improved dynamic manipulability of the system for the user and reduces the apparent inertia of the device. Enhanced dynamic manipulability results in improved force feedback to the user through the system. The weight compensation mechanism of the proposed device is composed of two zero rest length springs and one counterweight. Parameters of the mechanism will be calculated based on the fact that, for all configurations, the potential energy is the same, or partial potential energy over partial joint angles is equivalent to zero. This video demonstrates the frictionless weight compensation mechanism and the quality of force feedback in the 3D printed platform. The kinematic manipulability measure of the proposed mechanism at the input angle theta is defined as W. That is the square root of Jj transpose, where J is the Jacobian matrix of the robot manipulator. Intuitively, kinematic manipulability measure W represents the mapping between input velocity theta dot to the output velocity p dot. Higher kinematic manipulability measure of the device determine better postures and better points in its workspace in terms of dexterity and maneuverability. These configurations are called optimal postures and optimal working positions. The figure shows that the kinematic manipulability measure is at its maximum value in the vicinity of the patient where the device is operating. It means that the device has the best maneuverability and enhanced dexterity when it is operating near the patient compared with other configurations of the device. This video shows the performance of the design platform in the ultrasound scanning task. You can see free motion, vertical scanning, and pivot scanning. In pivot scanning, the transducer is slightly swept, pivoting on the point of interest by changing the pitch and yaw orientation of the probe in a fixed contact point. This feature could be passively achieved by implementing a compliant homokinetic coupling between the end effector P and ultrasound probe. Five participants performed the ultrasound imaging process using the proposed device. Metrics used in the NASA TLX subjective assessment tool were success in the task completion, mental demand, physical demand, performance of the platform, user's effort, and frustration. The statistical results of the NASA TLX subjective assessment tool for all participants indicate that all of the participants had a good experience with the usability and performance of the device in a relatively complicated ultrasound scanning task. Moreover, participants were unanimous about the low required physical demand. It can be attributed to the gravity compensation in the device and the comfortable posture of the shoulder joint during ultrasound imaging with this device. In this paper, a remote healthcare service delivery system was introduced that is simple, safe, and human powered and is ideal for reaching, sensing, and manipulation from a safe distance. This platform is very useful in protecting critical care and hospital staff from COVID-19 and also is very helpful in decreasing the cross-infection risk between hospital staff and patients and increasing the quality of care provided to patients. Intuitive operation, gravity compensation, and end-effector compliance resulted in a device with high performance and low user's mental load during the operation. We would be grateful if you visit our research website. Here is the list of some papers regarding the impact of COVID-19 on medical robotics and wearables research. Thank you so much for your attention.